Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Thanks for tuning in to this quick tip episode. So today we're going to really just focus on why the majority of private practices fail a HIPAA compliance audit. I think the biggest thing is most private practices don't know what they don't know. And sometimes it could be deemed gross negligence. And I think it's simple things. So I'm going to go into a bunch, but I want you to think about it in this way. If you were to walk into a doctor's office tomorrow, would you be able to see, hear, or experience any aspect of another patient's health information? Even something like, hey, Lisa, it's so great to meet you. And what if you knew Lisa? What if Lisa was someone you knew and you're in the waiting room and all of a sudden they're like, Lisa, we're ready to schedule your hysterectomy. Oh my gosh, that could be seen as a HIPAA breach. We just heard Lisa, and granted, they didn't say Lisa Seigel, they just said Lisa. But what if I know Lisa? And now I know that Lisa is getting a hysterectomy. It's easier than you think. The other thing is sometimes I'll come in to a waiting room and I'll see a list of all the different patients and what type of visit they have right when I'm signing in. I'm like, you're supposed to put a sticker on that. I also see it where I walk into an office and their screen, they've got like a 32-inch super screen, high definition, and I can actually see the patient's chart that they're making notes in. Truly. So this is more common than you think, and I think we just don't recognize it. I also am finding the way that we transmit data, I'm shocked by how many vendors people are using that do not provide BAAs. And I'm like, hey, you're using this company and you don't have a BAA. Even a company that is HIPAA compliant, they don't even recognize they need to actually facilitate the request for a BAA. So I'll give you an example. I'll go into a practice. I'm like, hey, what are you using for your email? They're like, oh, we use Google Workspace. And I'm like, okay, can I see the BAA on record? And they're like, oh, I know it's here and blah, 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 blah. And sure enough, they don't have a BAA. You're like, well, Brandon, when you sign up, you get a BAA. No, there's a process to actually request the formal BAA. So what happens? They're like, oh, that's easy. I'll get it now. And I'm like, yeah, but now it's showing the date of today. What about all of the prior time? So making sure your vendors are getting you BAAs or you're taking responsibility, you should have a BAA file for every vendor you're working with. The other thing we're seeing, so common reasons why private practices are struggling with HIPAA compliance audits, we're seeing inadequate staff training. Employees are lacking regular, comprehensive training on HIPAA regulations. It's leading to unintentional violations like discussing PHI, and I'm often seeing a mishandling of records. Even sometimes I'll see someone has a paper chart, and that paper chart they'll have a stack of charts, and I can see the name, and even diagnostics sometimes are on that. So we need to make sure that we're doing our staff training. The other thing that is common is we're seeing a failure to conduct risk assessments. Practices are not performing annual security risk assessments. They're missing vulnerabilities and physical safeguards. Lack of written policies and procedures. I'm seeing so many not have HIPAA guidelines, HIPAA policies, HIPAA. I have a binder of HIPAA function. A privacy statement is not the same as your HIPAA policies and procedures. Go to MGMA and purchase the template for your HIPAA book and get your HIPAA policies outlined and clear and trained. I'm often seeing unencrypted PHI, so failure to encrypt patient health information at rest. So we're seeing devices and servers. We're seeing that transit is not being encrypted, meaning that when they're sending stuff, it's not being encrypted. And we're seeing increasing breach risks. The reality is that cell phones are creating and contributing to the breach of HIPAA. The more that we depend on these mobile devices and we are not utilizing the right secured devices, the more issues we're having. We almost need our devices to feel like a burner where they can get destroyed at completion because they're too susceptible to breach. We've got weak access control. That is something I'm seeing a lot. I'm seeing inadequate restrictions. You're just letting anyone do anything. Like I come in and you're like, hey, Brandon, you've got full privileges and go in. I should not have access to anything that is not a requirement of my job. Did you know that? So if I am a nurse and I am only responsible for we'll just say the regular health levels of that patient, I should not have access to surgeon reports or other prior history. There should be restrictions on what patient health information I have access to based on the role that I play. If I'm a scheduler, I don't need access necessarily to the whole patient health chart. So really being able to create access controls, it's crucial. Other things I'm seeing, again, no business associate agreements, missing BAAs with vendors, your IT providers, your billing providers. It's so funny when I send out, I will not talk, look, do anything until I've given you a BAA when it comes to, before we even go under contract, I get a BAA in place because for me to look and see your system before you buy me, I want to know what I'm dealing with and I want to make sure you're protected. And I'm like, hey, do you have a BAA in place with your current billing provider? They're like, oh, I'm sure. And I'm like, where is it? They're like, oh, I guess we never got that. We must have overlooked that. Don't overlook it. That's gross negligence. You are liable for third-party non-compliance when you do not have a BAA in place. Improper patient health information disposal. I will see something that someone thinks is not a medical record, and it has patient health information. So it'll be some kind of note or something. And it might not even be a clinical note. It could just be like a note like, hey, can you have the doctor, love Brandon Seigel with my, whatever identifying information. That should be shred. How we discard information. So anything that has any kind of identifiable information should be shred. I see very commonly insecure communication processes and practices. People are using non-compliant phone systems. So again, just because the phone system says we are HIPAA compliant does not mean that they are encrypting. Again, there's two different things, how it's resting and how it's transmitting. Making sure you know the way that things are being encrypted from a resting place to a transmitting place is very crucial. So looking at your voice over IP systems, your texting systems, your policies and procedures related to phone calls and text messages is just as important. Poor physical safeguards. We're seeing public areas with reception desks with visible screens, a lack of locked storage information so that I could go to anyone's office and pull out stuff from their filing cabinet. Eavesdropping, theft, all ways that people are not utilizing proper safeguards. The other thing is we're seeing a delay or missing breach notifications. Failure to identify breaches. You're like, oh, I saw a company that's like, yeah, one of our providers can't find a chart. And I'm like, what do you mean they can't find a chart? Like a physical chart. And I'm like, it's gone. I'm like, how long has it been? And they're like, like 30 days. I'm like, and you haven't found it? Like, no. I'm like, you better send out, that's a breach. So the breach is the data is nowhere to be found. Now, you might be like, well, what if it's shred or this or that? I go, if you did not intentionally discard it, then that data is a breach, in my opinion. Again, I'm black and white. Inadequate documentation. There's a lack of records for the training you take, the risk assessments, the policies, the patient consents, etc. And then outdated technology, using legacy systems or unpatched software, vulnerable to cyber attacks and compromising ePHI, electronic PHI security. So we need to make sure we're doing all of this because without it, we cannot ensure that we are securing our patient health information. We want to implement annual staff training. We want to conduct mandatory HIPAA training for all employees at least annually. cover PHI handling, secure communication, understanding breach reporting, use real-world scenarios, and document attendance. We want to conduct regular risk assessments, perform annual or biannual security risk assessments to identify and address vulnerabilities in administrative, technical, and physical safeguards. Hire a compliance consultant if you need. It will be cheaper than if you get audited. Develop and update your policies. These are things that are always changing. Create comprehensive written policies and guides, and also just workflow, how you're doing those things. What's the management, communication, your breach response, your disposal process. Review and update these yearly to reflect your regulatory changes. Encrypt all PHI. Deploy NIST compliant encryption. We're going to use AES 256 most of the time for storage, TLS for transmission. We want to make sure that all of our devices, servers, emails, texting platforms are handling PHI compliantly, and that we verify encryption during risk assessments. Strengthen the way that we access things, unique logins, unique passwords, making sure we have multi-factor authentication, making sure we have role-based access to limit PHI exposure so that PHI is only to authorized personnel that actually need it. We want to have secure BAAs with our vendors. We want them signed. We want them dated. We want to establish secure disposal protocols, cross-cut shredders. We want to make sure we have wiping tools. We want to train staff on proper disposal procedures. We want to adopt HIPAA-compliant communication tools using encryption, like a Tiger Connect, like a Spruce Health, like these different ones that are utilizing encryption. We want to enhance physical safeguards, install privacy screens, soundproofing, white noise. And I want to be crystal clear. Anything you hear in these episodes, you need to do your own due diligence. Don't take my word for it. Don't be like, oh, I chose Tiger Connect because of Brandon. I'm giving an example of a tool. I am not endorsing the tool, and I am not sharing that they are fully compliant. I am saying that they advertise they are. It is your job to ensure that these vendors operate and facilitate full compliance and that you are holding a standard to them. Did you know in 2024, a compliancy group report found that 65% of private practices fail HIPAA compliance audits simply due to inadequate staff training? And their fine averaged $50,000 per violation. In the words of Thomas Jefferson, vigilance is the price of liberty. Thank you so much for tuning into this episode. I hope that you will like us, subscribe, share us, be part of our community, because remember, together we can thrive, not just survive. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you loved this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.